Welcome back to Medicare Bootcamp. We're now in video 7. So last video we talked about Medicare Advantage. We also talked about Medicare supplement plans. And this video we're going to bring them side by side and do a comparison. Medicare supplement plans versus Medicare Advantage plans. We'll go through a number of different topics, and then I'll give you a little bit of like what each plan might be better suited for different situations. Okay. So first off, their structure is a little bit different. So with a Medicare Advantage plan, you basically replace Part A and B, and you have a privatized insurance company. The plans are contracted with Medicare. Remember, there's already a relationship. You need to have A and B in place, and then you can have a Medicare Advantage plan, and that's your only, plan. It also covers prescription drugs and a lot of extras, um, dental, vision, hearing aids, and a number of other things, gym membership, over-the-counter credit, maybe grocery cards, even money for rent. So all of those things are not part of Medicare, but they're part of a Medicare Advantage plan. And to the degree of, there's different plans. There's so many. Okay, Medicare supplement plan is basically you still have A and B in play. That is going to be your primary insurance billed to Medicare. And then you have a supplement plan, again, through a private insurance company. And that would basically take care of the rest of whatever Medicare would normally cover. So that 20% gap is what's filled in a supplement plan. You still don't have all of those extras that I named off associated with a Medicare Advantage plan. You may have to pay extra for that, or you will have to outside of Medicare. So there are standalone um, uh, well, you'll need a standalone prescription drug plan for sure, but you'll need a dental, vision, anything else like that. So you'd just be aware of that. So a lot of people think, okay, well, I have that. That's going to take care of everything. This is what we're talking about when we get into the nuance of these things. So just be aware of these things, and that's why I'm creating this for you. Okay, so there's a network issue, especially this year. Our annual enrollment period is going to have a lot of people that are not going to have their plan next year. 1 in 5 plans are ending. That's super important. And it has to do with networks. A lot of those plans are PPO plans. That's part of a Medicare Advantage type of plan. PPO is Preferred Provider Organization. That's where you can actually go to a doctor that's outside of the network. And if they, one, agree to take and bill your insurance, and two, are Medicare approved doctors, then you can see them. However, under a Medicare Advantage plan, PPO type of plan, you will pay a higher copay to typically to see those doctors or to go to those facilities that are outside of the network. So even with that increase of co-payment or co-insurance with those things, those still have been unpro or yeah, they're losing profit. The insurance companies are, or they're not profitable, or whatever the case is. And there's a lot of other nuance that uh, come is involved here, but a lot of those plans are ending 1 in 5, so that's huge. The other type is a HMO. A Medicare Advantage plan that is a HMO, Health Managed Organization, basically means that it's a closed network. You cannot see a doctor that's outside out of the network without paying the full price. Basically, there's no coverage there. So the idea here with the HMO is that it's all contracted, it's all dialed in, and this is usually the lowest cost to the recipient for their healthcare. So that's important to keep in mind. So, but one of the things involved here with the HMO is that yes, you do need to have a referral from your primary care physician to go to a specialist. They're going to refer you to another doctor within the network. Okay. So that's how that works. Another little piece of information here about that. Prior authorizations and referrals are now going to be streamlined a little bit with the introduction of AI. The artificial intelligence is now going to be implemented to speed up those processes. So that is an encouragement if that's been a hang up, which it has been for a lot of people for a long time, all of this network stuff, because in a Medicare supplement plan, there's no networks. If they are going to take Medicare anywhere in the US, they'll take your supplement plan. And there may be outside of the US coverage. Of course, both will have emergency coverage. Once you get back, you send the paperwork, whatever. But yeah, so that's the difference as far as the networks go. Okay, so let's talk about cost. On the front end, meaning premium, which is everyday payment for the plan, um, a Medicare Advantage plan is usually going to be $0. And we talked about the funding and how that can happen. But yeah, $0 for all of those extras that come with the plan, including medications. So when you have medications, you do not have to worry about a late enrollment penalty associated with not having prescription drug coverage for any amount of time. So that's an added benefit. Um, and it's structured in a way that because you're not paying on a monthly basis for the premium, you pay as you go. So you will have uh, co-payments for your doctors, specialists, and you'll have co-insurance for procedures, having inpatient hospital coverage, that kind of thing. Keep in mind the Medicare Advantage plans have a ceiling, also known as a maximum out of pocket, that you should be aware of. And typically those could be, roughly 3,000 on an HMO. Um, these are national numbers, so they're very wildly. And then up to like 7 or 8,000 on a PPO plan. So that's the difference of what we're looking at here. Okay, so a supplement plan, you can pay anywhere from maybe 150, 200, 250, something like that on the lower end, and then as much as 500 or more on the higher end. And here's why. You basically will pay that premium. If you get into the plan immediately when you're eligible, then it's called a guaranteed issue, where they don't have to ask you all sorts of medical information. After that 6-month period, then if you want to get into one of those plans, you could be flat out denied, or they can say you need to pay basically double the amount or whatever it is to be in the plan. Now, once you're paying on a monthly basis in the supplement plan, then you still have that Part B $257 deductible to deal with. But after that, basically there's no other additional costs. So you're paying, anywhere from average of maybe $300, something like that, on a monthly basis. And there's pretty much after that 257, then there's nothing more because that's what's the supplement is for, to take care of everything else. So, but to back up a little bit, you also need a prescription drug plan. And remember when we talked about that, that was $46.50 on average. Could be more, could be less, just depends on what's available to you in your area. And so that doesn't actually cover the cost of the medications. That just allows you to be in the plan, which would, be negotiated prices that hopefully is a reduced amount. There still may be deductibles and, other out-of-pocket costs associated with that plan. So, so by and large, it's kind of like, well, you're going to pay higher on the front end, but if you're utilizing the plan, that could be even all of that that's going out throughout the end of the year could be a lot lower than all of those other expenses. If you're frequently going to specialists getting procedures, people that are really sick and frequently have to use their plan, that could be a much higher amount. So it this is why we kind of weigh out what is best for your situation. Okay. Oh, we already kind of talked about the extras. I kind of included that on the front end of the conversation. So yeah, supplement plans may include language like there's dental and vision. That's typically not coverage. It's usually a discount. So rather than having, X amount of dollars allotted for dental care, it's usually, well, whatever you pay, we're gonna pay part of it kind of thing. So it's just structured a little bit differently. Okay, so we talked about medications as well. Medicare Advantage plan, it comes with, you may still have a deductible there. They may choose to place that deductible in the higher tiered things. And then a prescription drug plan is going to be the alternative if you have a supplement plan. Okay, so let's talk about travel. So as you travel, a supplement plan is going to be optimal because, like we said, it could be a- acceptable anywhere in the US. And if you have a Medicare Advantage plan, okay, you're still going to have urgent and emergency coverage kind of wherever you go. That's not a problem. However, if you're doing long-term visits, you may or may not have coverage there. One of the things that's changed because of just the time we're in, I guess, and also some of these companies are so big nationally, that you can be in network even in different states. Some of those have specific plans that are built for that, kind of built for like a snowbird situation where you have two homes depending on what type of the year is. You're gonna, go back and forth, that kind of thing. So it just depends on what's available to you. So um, let's see. So the mindset here, it's not so much about what's better, it's about what's better for you. What is the ultimate cost and the preference that you have. Do you want to just pay the money? That's not a problem, and you're just happy with the assurance that you are covered, right? Otherwise, if you're like, no, I'm not going to pay that much if I only go to the doctor once a year kind of thing for a checkup. So those are the things that we weigh out. So I hope this has helped. And as always, I hope you are equipped with the checklist that I've created. This is going to help you immensely with whoever you choose to help you in this annual enrollment period coming up. I'll be talking more about that in our next video. But yeah, you basically are going to have a full conversation. Expect to talk about all of this stuff to see what's important for you and to see what plan emerges as your optimal plan. Okay, you can click the links below. If you are inclined to do it yourself, there's a button there. You can click through, look at the plans that are available to you. The new plans for the new year are going to be available October 1st. So if you want to just tackle that, great. Yeah, I'll have a little video there. You can figure that out if you'd like. Otherwise, you can reach out to me directly. And there's links below where you can sign up for a discovery call with me. So you can grab a half hour. We can talk about all of this stuff and figure out what's going to be a good fit for you and see how I can serve you later. And then you just feel free to reach out if you have any questions. I'd love to answer those. I've kind of done all of this work pre kind of like looking at who's searching for what and what's the popular questions, but I know there's nuanced questions out there and I'd love to help you out with that. Okay, so I'll see you in the next video.